Good morning, good afternoon, and good evening according to the time of the day that you are watching this video on ECG. So let's break the false belief first that electrocardiograph is the paper. It's not like that. Electrocardiograph is the instrument that is used, and electrocardiogram is the paper you see. It was discovered by William Einthoven, for which he was awarded a Nobel Prize, a revolutionary discovery in the field of medicine, widely used as an emergency diagnostic tool of various heart conditions in any kind of hospital. You must have heard about the beep beep or beep beep sound in movie or in TV series or in a real life hospital. So what does ECG do? ECG records your electrical activity of heart. So you must be thinking that what kind of electrical activity is occurring in our heart. So let's elaborate this thing a little bit more. We must be aware of the fact that AC node and AV node, these kind of nodes that are present in your heart, are producing some kind of electrical impulse that is required for your heart to beat. So yes, this impulse generated by AC node and AV node are actually electrical in nature. So there is some electrical activities occurring inside your heart. ECG records this electrical activity that is occurring in your every cardiac cycle. So how ECG is recorded? We place various electrodes or leads on your chest and limbs and record the electrical activity of your heart from different angles. Nowadays, we use 12 lead ECG. Out of these 12 leads, 6 are chest leads placed on various positions on your chest, numbered from V1 to V6. Only V1 at the right hand side and the V2, V3, V4, V5 and V6, all these 5 chest leads are placed on your left side of the chest. So the exact location you don't need to know for your NEET UG exam. And 3 are limb leads. The electrodes are placed on the right arm and left leg. And there are 3 augmented limb leads. Just know their name, AVR, AVL and AVF. How they are calculated, you don't need to know at this level. So let's talk about the paper a little bit. So this is a large box comprising 5 by 5, that is 25 small boxes. So along the x-axis of your ECG paper, we measure time in second. Yes, every small box along the x direction measures 0.04 second. So a large square measures 0.04 into 5, that is 0.2 second in x direction. And in y-axis, we measure the voltage. We measure the voltage that is generated due to the electrical impulse occurring in your heart. And one small box along the y direction is equal to zero point 0.1 millivolt. Please remember these two facts. One small box along the x direction of this graph paper is equal to 0.04 second, and one small box along the y direction is equal to zero point 0.1 millivolt. Just remember this fact. You will be able to say if the question asks about the large box in ECG paper. So this curve that you see in your ECG paper are actually waves. 3 waves are there primarily in a normal healthy individual, that is P wave, QRS complex, and T wave. So let's talk about these waves. And before understanding these ECG waves, we need to understand two popular terms, that is depolarization and repolarization. Depolarization and repolarization indicates two different state of electrical activity during an impulse production. Just remember the fact that depolarization is the electrical activity which leads to contraction of a muscle, that is systole in this case, systole of your heart chamber. And repolarization is the electrical activity that leads to relaxation of your muscle, that is diastole of a heart chamber in this case. Normal ECG wave are three in number, that is P wave, QRS complex, and T wave. Now what does P stand for? P stands for your atrial depolarization. And this P wave is generated due to the impulse generated by the AC node. And this atrial depolarization leads to your atrial contraction, that is atrial systole, both the atria, right and left together. So P wave is generated due to impulse generated by AC node. It leads to it causes atrial depolarization, which leads to atrial systole. Now QRS complex is due to ventricular depolarization, which leads to ventricular contraction, that is ventricular systole, both left and right ventricle together. And T wave is the ventricular repolarization, which leads to ventricular diastole. Now, one popular misbelief that I want to break, that is depolarization and contraction is not exactly same. It's not equal to. I mean, you say P wave is atrial depolarization, but P wave is not equal to atrial contraction or systole, because P wave is the electrical phenomena, that is atrial depolarization, which leads to atrial systole. So you will be getting atrial systole at the end of P wave, somewhere like this. So P wave is atrial depolarization due to the impulse generated by AC node, it's okay. And at the end of P wave, you are getting the atrial contraction. So similarly, QRS complex indicates ventricular depolarization, which leads to, which causes ventricular systole somewhere at this place. And T wave is ventricular repolarization, which causes ventricular diastole. So that's the minute and fine difference between the depolarization, repolarization, and the actual contraction or relaxation. So one is cause, another is effect. So yes, P denotes the generation of impulse in AC node, and therefore atrial depolarization, which leads to atrial contraction. QRS complex indicates ventricular depolarization, which leads to ventricular contraction, that is ventricular systole, and T indicates ventricular depolarization, which leads to ventricular diastole. So one thing we are not able to see, that is atrial repolarization or atrial diastole. Why? The reason is very simple. You see, this is atrial depolarization, that is systole, we can say. This is ventricular depolarization, or ventricular systole, you can say. So you see, ventricular systole is a more powerful phenomena than atria. So yes, the amplitude of the QRS complex wave is much higher than P wave, as ventricular depolarization and contraction is more powerful than the atrial depolarization or systole. So you see, this is ventricular depolarization leading to systole of ventricle, and this is ventricular repolarization leading to ventricular diastole. And this is atrial depolarization leading to atrial systole. You see, the atrial depolarization is so small compared to ventricle. So if depolarization itself is so small, how can you trace repolarization? Na? That's why you will not be able to see the atrial repolarization in this case. So uses of ECG are many. Life-saving conditions, actually. If you diagnose early, you can treat the patient. So various kind of arrhythmia, that is irregular heartbeat, can be detected by ECG. They may be brady or tachy, meaning slow or fast, irregular heartbeat. Obviously, the popular one, myocardial infarction or commonly heart attack. And also you can diagnose various electrolyte or iron abnormalities in your blood. For example, a patient has some increased potassium in his blood. This will cause some irregularity in cardiac function, and that can be tracked by using ECG. Now one more thing, calculating the heart rate from ECG, that is very simple. Anybody can do it. The formula for rate is 1500 by number of small squares between two consecutive RR interval. Just let's do it. Let's look into this. Here, number of small boxes between two consecutive R is 10, right? So the heart rate will be 1500 by 10, that is 150 beats per minute. Here, number of small boxes between two consecutive R is 15, so 1500 by 15 is 100 beats per minute. And here, number of small boxes between two consecutive R is 5 small boxes, so 1500 by 5 gives us 300 beats per minute. So 3 configurations, 3 different ECG actually clubbed together. So thank you guys for watching. If you want to learn about more topics which are important for an ETG, you may like to share and subscribe. Thank you.